I just have to tell everyone, Sherri, Dr. Greene, we were just trying to figure this out a few hours ago, like how long have we known each other? And we're thinking 19 years. And what's so interesting to me is Sherri is one of those friends, if those of you have ever experienced this, where you really connect to someone like heart, like soul connected, and you move in and out of life with them. And you always seem, when you come back, there's this moment of like, I got you. I'm here. You've always been here. And that's what Sherri has been for me. She's been there in times of craziness in my life, and then in times of like where life has been really great, and we kind of played this really cool friendship dance. And it reminded me of that saying, like, find your tribe and love them hard. And I remember back, Sherri, do you remember when I kind of came up with that crazy idea about this kind of concept and I brought it to the Discovery Channel? Yep. Right? And I was sitting in Sherri's apartment and we were having tea and we were talking about how can like we go out and find these medicine women and medicine men all around the globe and really learn these like indigenous ways of healing and healing our hearts and healing all the people that we come in contact with. And so like now this integrative wellness collective is kind of my modern day approach to this thing that I had, this idea that I had 15 years ago that you were part of then. We didn't know how to necessarily make it to come to fruition, but it's happening now. And the fact that I get to have you on and the people that I've admired and loved and really have just, you've taught me so much that like I get to celebrate you and your gifts to be here. So I just feel so blessed about it. And
I just love it. It's just like it's full circle, you know?
Full circle.
Total full circle of like why it had to wait till now to happen.
Right. Well, it had to be, right? Yeah. And you know, and you're a firm believer too. It's like everything happens when it's supposed to happen.
Divine
so time. This is happening now, and the fact that I can't hear you and there's no volume, that's supposed to be happening too. And I'm just gonna have to see her lip read, and that's okay.
Oh, I'm so sorry.
But let me tell everyone how wonderful you are. Dr. Greene, she is a holistic podiatrist. Something that the two words that you rarely hear mixed together in Western medicine. She graduated from Temple University and she did a 2-year residency in surgery, right? Podiatric surgery. Yep. And the thing that I love the most about Dr. Greene is her holistic approach to just looking at someone's injuries. She integrates their life and looks at the body very holistically. So you're not just a patient that comes in with foot pain. You're somebody that comes in as this whole being with whatever issues you have. And she's able to take her, decades of experience and decades of researching and her education in all of these multiple modalities that make her this wonderful practitioner. So I wanted to start some questions for you because most of the people out there, and including myself, what exactly is a holistic podiatrist? And on your website, you call yourself a restorative physician. Correct. And I love that. What does that mean?
So, well, thank you so much for that whole introduction. I'll try to yell if you can hear me.
I'm like, I'm listening.
I know. Technology, I swear. But, and it's so glad, I'm so happy to be here. I'm really honored to be here with you tonight, honestly. So holistic podiatry really came out of it was like born out of this desire of when I came out of my surgical residency and I was really sorting through everything that I learned in my training and then dealing with like patients who had so many complex issues that, drugs and surgery didn't seem like enough. It seemed like there were missing pieces for me to understand how to translate what came out of the textbook and what I learned in the OR and what I learned technically and then how to apply it to real life, to real situations for people who weren't just a foot. Like, they came in with so many other challenges and so many other things that I just felt that there needed to be, I needed for my own desire to understand the true art of healing and why some people got better using those techniques, and why I had to find other things, or those people that just became more chronic injuries and chronic cases that just wouldn't budge, no matter what protocol that I learned in school. So I just went on this like crazy exploration of studying so many different alternative modalities to try to figure out how I could bring all this back into my practice. So it became like my creation of what podiatry was, which was mind, body, spirit, combining it all to figure out how to help somebody to heal, to truly heal, not just heal the physical, but heal the mental, emotional, spiritual, all of it, because you can't separate anything out. You never can, right? There's always all those components. And then the restorative physician really came out over the past 5 years, because I began to study a lot of functional medicine and functional nutrition. And basically where that came from is, how do I restore somebody's body? How do I bring them back and restore them to what the original blueprint was, right? The original blueprint of health and wellness for somebody. So that's what became more of a restorative physician. Plus, I also started to work more everything outside of the foot and ankle. It became much more autoimmune conditions and, chronic illness, chronic pain, which was so much more than just foot and ankle. And I did a lot of studying to really expand my practice into helping those people to restore whatever is out of balance.
Mm-hmm.
So that's where that came
from. I need to see if I could turn down the volume in the room, because I'm going to need hearing aids when this is done. I don't know what this means emotionally, psychologically. Why is it? I love listening to you, so why am I not able to hear you? 1 second.
Okay. Oh, goodness. Technology. Thanks, everybody, for being here, hanging in with our...
Okay, let's see if that I don't know. We'll turn that down. Okay, so my second question to you then is, you talk a lot about nutrition, because the last time I came to see you, I came in for something that we thought was possibly Achilles tendonitis. It was, due to my overuse in running. And, oh, good, thank you. She's saying that everything's good on her end.
At least
unfortunately, I'm the only one that can't hear anybody right now. I'm trying so hard to lip read. I'm like, can we just do sign language? I don't know. Anyway, so, you've always been a proponent of healthy eating and nutrition. Yes. So as someone who's integrative like this, when someone comes to you with some sort of inflammation or overuse injury, or something as simple as Achilles tendinopathy or plantar fasciitis, most people want either a pill, something to rub on them, a stretch. People come to me for either acupuncture or PT. Give me the stretch.
Or
give me
shot.
the needle.
Or
what?
Or a shot.
Or a shot, right, which is you. Yep. And I want people to understand that two things for you anyway. One, you give them a lot of nutritional advice, which I do too, as this kind of anti-inflammatory. But two, you injected me with homeopathics,
yes,
which was, something that most Westerners don't really understand. Right. And I have to say, the homeopathic injection you gave me was very beneficial, and it did create an anti-inflammatory experience. So tell everyone what homeopathic injections are and why you would use them in lieu of something like a cortisone injection.
Sure, absolutely. I really started to get involved in homeopathic, or called biopuncture, injections fairly early on, because I was looking for something outside of cortisone, because cortisone is great, but it's a Band-Aid, and it does, reduce inflammation for sure, but it also weakens the tissues over time, and even can weaken the tissues early on. And I can tell you of an example of a plantar fasciitis case where I gave a cortisone shot very early in my career, and she felt so good, and she went out to go play tennis, and guess what happened? She tore her plantar fascia.
That's right.
It. So, she was instructed not to do that, but she just thought she felt so good to go do it. So when I found homeopathic injections from actually an orthopedic surgeon who came to the United States to talk about it and to give a workshop on it, I was like, I thought this was the most amazing thing ever. So basically what it is like homeopathy is like cures like. And these are like combination remedies, homeopathic remedies that are actually used to heal, like you're injecting, it's just plant mineral to be able to get that part to stop the inflammation. Now there's different remedies for chronic cases, there are different remedies for acute cases, there are remedies for arthritic cases, for edema, for swelling, for trauma, for all different types of remedies. And basically what you do, it's this very, more superficial type of injection usually. Sometimes it's around the joint, but it's used in lieu of a cortisone shot because you're actually stimulating healing. You're actually getting the body to remember to do what it does best and not suppressing anything. You're actually, giving it a remedy that is going to help to stimulate healing within the tissues. So it doesn't work like a cortisone shot to just suppress something and make it all feel better temporarily. You're actually giving a remedy to start that healing process going for that patient on a cellular level. So it's very powerful.
Yeah. I mean, it's definitely powerful.
You could do multiple injections.
And you could do multiple injections. Yeah. It's interesting with the cortisone injections because I know from a very Western perspective, like the magic number is 3, right? Like you can only have 3 cortisone injections a year. And, and it breaks down tissue. And I've had plenty of patients that wound up getting, cortisone injections in their knees and all of a sudden they now have a ruptured Achilles tendon.
Yeah.
And so the repercussions of that immediate relief, right? We want it now, but we don't think about what happens in the after effect, which is, unfortunately that pharmaceutical kind of approach to medicine right now, right? Which is like, let me take the magic pill. But it's funny because I had an experience myself when I was in acupuncture school, early 2000s. We were learning about, we had a teacher who's really fascinating. He worked on more of the psycho-emotional aspects of the body and how they relate to different areas of the body. And we just so happened to be talking about sports injuries. And at the time, I had pretty bad plantar fasciitis. And he gets me on the table and he's like, oh, I'm going to palpate your abdomen. And I'm like, what does he need my abdomen for? Like I was brand new, right? In school. I'm like, my foot's the problem, not my belly.
Right.
So, he lifts up my shirt and he said, you have a belly ring? And I was like, that was like an 18-year-old oops, right? Like, yeah, I guess I just never took it out. And he said, well, what if I told you if we took the belly ring out, the pain on the bottom of your foot would decrease?
Wow.
And I'm like, what?
That's great.
So of course, everyone in my class is like, take the belly ring out, right? So I'm like, okay. So he's like, does anybody have pliers? And I'm like, pliers? So somebody like whips out pliers and they like take the belly ring out. Now he had palpated the bottom of my foot right at the calcaneus. So for those of you out there, it's like right by the heel, right where the plantar fascia inserts. It's the very typical place where plantar fascia really rears its ugly head. So he palpated the bottom of my foot, and I mean, I was like seeing stars. He takes the belly ring out, and he goes back down to the bottom of my foot, and he's jamming his fingers in there. And I'm like, are you pressing as hard now as you were before you took the belly ring out? Because I don't believe that the pressure's the same. And he's like, yeah. And it was like this mind-blown moment because the belly ring, where most belly rings are in women, it's called CV6. It's the conception vessel, right, which is where our heavenly blood runs through. And in Chinese medicine, the blood is a really important piece of our internal system. It warms tendons, it nourishes tendons, it nourishes ligaments, it keeps our vitality. So when you have a piercing or a belly ring, or it creates a stagnation in where that sea of blood was. So if the blood nourishes tendons and ligaments and connective tissue and fascia, by unstagnating it, you're allowing things to move. And it was that like one aha moment for me. And for women with menstrual cramps also have a disturbance in the way their heavenly blood is moving through their body. So we call those menstrual cramps some sort of stagnation of blood. Right. So when that happened to me, it was like this moment of, oh my God, I didn't have to take a pill. It was that like curing like. I pressed the reset button. What's that?
And the connection between all of it, right?
Yes.
The connection between the flow of between the ring and your belly button and your foot. Like the body, you can't separate parts of the body.
You cannot.
Out. Yeah.
Yes, you cannot. And somebody just asked about what about men? Absolutely, right? In Chinese medicine anyway, right? I mean, we all have the same meridian systems. We're not separate. So, and for you as well, homeopathic injections are going to work for men just like they are working for women.
Yep, absolutely.
Anyway, I thought about that when I was kind of constructing this question for you, because I'm like, when did I experience at Plantar Fascia, and what profoundly worked for me, which was, this experience.
So let me talk about plantar fasciitis
Yeah.
for a second, because it's really interesting, because it really does show up differently for different people. Yep. Like even exactly where that pinpoint pain is. I mean, it's usually right at that medial tubercle and the calcaneus, but it can shift. It can shift lateral. It can shift a little more medial. It can shift a little bit more proximal and a little more distal with each person. But here's what I found, because what was happening for me in my practice, I would get those people that been to 6 different podiatrists and they were not getting better. And they had orthotics and they had cortisone shots and they had stretching routines and they had strapping and taping. So here's where a piece of it came in for me early on. When I dealt with somebody's diet from an inflammatory perspective, that was a missing piece for a lot of people. Now, some people, when you do the regular traditional things, they get better. Mm-hmm. Yeah, I've seen people, within three months, their plantar fasciitis is gone. We're talking about the chronic cases, the ones that come into my office and say, I've had it for 3 years. I'm like, plantar fasciitis for 3 years? Okay, so something is missing, right? Yeah. Something's missing. So here's the piece that I've come to understand and learn more on a deeper level. So inflammation is caused by 2 things. It's either caused by injury, or like repetitive injury or acute injury, or it's caused by low-grade viral pathogens within somebody's system. That what can happen is a virus kind of creates a toxin, and the toxin can kind of attach on to these frayed nerve endings. So if you've had an injury, or if you've had, because somebody will come in and say, yeah, I had plantar fasciitis like so many years ago, but it went away, but now it's back and now I can't get rid of it. So that nerve is kind of has been injured and it has some frayedness to it. So those neurotoxins can latch on, and that's where it becomes more of an issue of how do I reduce the inflammation from a more antiviral place and an anti-inflammatory place at the same time. And I have to tell you, it works.
So here's a question for you then from a nutritional standpoint. Is there something that you would recommend? Like, can someone pick up in their health food store? What are some of the things that you would use for maybe a viral component or just an inflammatory component? What do you suggest a lot?
A lot of times I suggest everybody is one of the most anti-inflammatory is curcumin. Everybody knows about curcumin turmeric. So people get on curcumin and turmeric. they get on something called nettle leaf. Nettle leaf is very anti-inflammatory. Make sure people are on magnesium.
Yeah.
For sure.
Yeah.
That's a big one. I get people on B12, and I get on a certain B12 that has something called methylcobalamin and adenosylcobalamin. The adenosylcobalamin is actually going to heal, repair, and the nerve. So that's a piece of it. And then when you're addressing the viral component, there are things like lemon balm. There are things like cat's claw. There are things like chaga mushroom. Like all of these things can help strategically play a role to help to knock down that viral load and repair the nerve and the inflammation at the same time. So yeah, you have to check biomechanics, and you got to make sure structurally that everything is on board here. So it's like kind of putting the pieces together, putting the structural piece together, the anti-inflammatory piece, and the possibility that there's a low-grade viral piece, which we're dealing with this crazy viral pandemic right now, right? And viruses are front and center. And even when people, they walk around with multiple viruses a lot of times, and they don't even know it. And, you know, half the world has had Epstein-Barr at some point in time.
Yeah.
So, you know, some of these things can get reactivated in the body. And I usually find the people that have had Lyme disease or have had some other type of...
Or chronic mold toxicity. That's a huge one in New York.
It becomes a major trigger. It becomes a trigger for a lot of this. So those are the pieces that, and I will definitely have to credit, you know, Anthony William, known as Medical Medium, for bringing some of these unique pieces to the forefront.
Right.
Because he's the one who's mostly talked about them. And I had the opportunity to have an in-depth discussion about it. And it put all these missing pieces together. So I was already holistic and working with the inflammation. And then it was all these little nuances that just took it to another level.
So I love that. What about the, I know that there's multiple types of magnesium. Just want to clarify that because, I mean, I typically take magnesium glycinate.
Glycinate, yep.
Oh, glycinate. And obviously I take Epsom salt baths, right? Which is the magnesium sulfate. So that's always really, and everyone's like, that's an old wives' tale. I'm like, get in your Epsom salt bath. You're going to feel better.
It's really good. I use the magnesium glycinate. I recommend Epsom salts, but I also sometimes use something called magnesium threonate. Magnesium threonate is for more central nervous system magnesium relaxation. So when somebody has so much chronic tension, like nerves tighten the muscles, that will relax the whole system.
Great. And is that something that you can purchase in the health food store?
Yep.
Okay. And it's magnesium
threonate. It's called
threonate.
Neuromag.
Okay.
Neuromag or Magmind, either one. Neuromag or Magmind.
Okay, great. So from a podiatric standpoint, I mean, I take magnesium and B12. Do you have any specific types and or brands that you recommend?
Yeah, definitely there's a company called Vimergy, Vimergy. They have the right B12, the B12 that has the adenosine.
You put me on that. I take that every day, the Vimergy.
Yep.
Yeah.
It's the best one. And Vimergy also carries magnesium glycinate.
Yep. Okay. Sandra, did you get that? Hopefully you got that. If not, just text me later and I'll give you that information. So as a podiatrist, what do you think about orthotics? This is a tough one for me as a PT because very oftentimes I evaluate someone's biomechanics. And right away, here's that quick fix again. You know, they want something to change their foot structure instead of technically changing it from my perspective, a musculoskeletal perspective, right? Working on things that might be weak versus strong, or working on someone's foot structure, doming, things that, especially when I was working with New York City Ballet, you see a lot of foot mobility stuff. And now that I'm more in the athletic world with triathletes that are also wearing very tight shoes in terms of cycling shoes. Right. So this woman here says she tried orthotics. I have so many patients that come and say, I just bought $1,000 pair of orthotics and they're in the garbage.
I know.
So what's your take on that? And how many people have structural foot issues? And also, is it because we never go barefoot as children? I mean, what?
Part of it. So here's what it is. I've had patients bring in an entire shopping bag of orthotics and shoes. And so, yeah, I totally understand that. It's a problem. And so, do I make orthotics still? Yes, but minimally, because I really have to teach the patient that they need to strengthen their foot. They need to strengthen the intrinsics in their foot. And the reason why the intrinsics get so weak, and that's why, there's so many different levels of why you get bunions and neuromas and tendonitis and bursitis, but the foot is weak. We're basically sticking our feet into shoes and forgetting about it until we have a problem. So when you don't walk barefoot or train barefoot, like I definitely am somebody who is a proponent of training barefoot. I think it's really important. I think in order to strengthen the foot, but I also don't think you should jump into barefoot training if you're wearing shoes, because it's a disaster. So you have to really find the balance with that. But I teach people how to strengthen their feet. And there are times where we do have to make an orthotic because, sometimes people are not going to be motivated to do all their exercises, and I can't get them out of pain, and they need to be supported biomechanically. And there is a place for orthotics. There definitely is a place. But my first go-to with a patient is to try to get them to strengthen.
Yeah. No, and for me too, for sure, because so many of them have orthotic issues.
And it's also, Bianca, it's also materials. You have to be careful when anything is too hard and too rigid.
Yeah.
It's just never going to be good.
Yeah. Well, 2 weeks ago, I had one of my other colleagues on. She's a PT and running coach, and we had this whole discussion about shoes and running sneakers, and how historically it went from like a flat sole to a thicker, wider, right? And now it's back to this kind of minimalist idea, and how hard it is for people to change, and then they wind up just, then injuries occur. So this woman here says, what about yoga to strengthen? I mean, that's barefoot, and it's single leg balance, and
absolutely, you're barefoot. So it's wonderful to get in touch with your feet and find your balance through yoga. It's a great place to start, for sure.
Have you ever used yoga toes? Do you know the yoga toes?
I use something called correct toes. I like correct toes even better than yoga toes.
Yeah.
They're amazing. I absolutely, with people with hammer toes and bunions and just sticking them in at night while they're watching TV and just like opening up the meridians and opening up the toes. Absolutely.
When I first started using my yoga toes, because I try to put them on 5 to 10 minutes a night, I remember my intrinsics were stretching so much that I wound up feeling the tension all the way up into my knees.
I bet.
And, I unfortunately have my great grandma's feet, and I do have bunions. And, people say to me like, ow, does it hurt? Or are you going to have surgery? And no, I don't want to have surgery on them. And I also have patients that have all had surgery on their bunions, and they return.
Well, you know what? Why they return? They mostly return because A, the biomechanics were never dealt with, and B, it was the surgery wasn't done, the proper procedure wasn't done for that metatarsal angle, the IM angle.
Yeah.
So if they don't close down that angle and they just work on getting the toe aligned, it's going to come back because the same forces are still there.
Yes, that's right. And, if your brain doesn't recognize that you have to walk differently, or that you have to take your center of gravity differently on the surface area of the foot, and you just keep creating the same walking pattern, you are going to create another bunion situation for yourself.
Gravity is going to make it keep going back to where it was. It's just, if you don't structurally fix the bunion correctly, at the root of the bunion and where the problem is, which is usually at the cuneiform joint, because that's where usually most procedures are done, at the head of the metatarsal. That's how we were trained. That's how I was trained. And it was more for the more aggressive bunion. It was more at the metcuneiform joint, but that surgery wasn't done as often. It was just done at the head.
Right.
And that's where 10 years, usually about 10 years down the line, you're going to see it return.
Not amazing.
Yeah.
And people think that when they go for bunion surgery that, they now have these beautiful, aesthetically pleasing feet for the time being.
For the time being.
Right. And they'll go back.
And
I did want to touch.
Well, I'm just going to say one last thing about the bunion. If you're not in pain and you don't care about having the most perfect foot, I mean, you're doing the right thing.
Yeah, absolutely. Yeah.
Yeah.
I think for a lot of people, it's more of, if it's not painful, it's just an aesthetic thing, right? They don't want ugly looking feet.
Yeah.
And, I don't know how you do it. I don't know if I can stare at feet my whole career.
I would just say feet have character. That's really what it is. It's really a character. So I don't think they're ugly feet. They're just different.
That's right. They're just different. Yes. So, which reminded me of a question that I had too, about calluses, right? Because when I was in acupuncture school, we had a really interesting Japanese acupuncture teacher who told us that you want to look at calluses on a person's foot and map them to what part of the meridian that they're on. And those calluses or excess growth of tissue creates more of a stagnation once again in that meridian flow. So a lot of people have calluses on that inside of the big toe joint, and that in Chinese medicine is the spleen meridian.
Right.
And what's so interesting about the spleen meridian in Chinese medicine is that correlates with a lot of things: edema, swelling, gastro issues, digestion problems. Like, do you ever find that or make that connection? I'm just from a traditional Chinese medicine standpoint, and then bring it to you in your profession.
So my understanding, and I've gone down the rabbit hole with this a lot, and calluses are often form because there's an area of rubbing. So if you just rubbed and rubbed and rubbed on a spot on your hand, you're eventually going to form a callus, right? Like if you work out, lift weights, you can build up all those calluses there, right? So there's a component of that, of where people are bearing weight where they shouldn't be bearing weight. But then there are still cases where somebody pronates and they are putting too much pressure and there is no callus. My feeling is, my experience, that there's a liver component to it. There's just a liver congestion and a liver toxicity and a liver sluggishness to that, these calluses that show up in these positions. I've read different books on different things where, they're metaphorical and what it's telling you. But I actually think when there's so much, the feet are like a map of the whole body. And there's so much you can tell from the sole of the foot and what happens and calluses and things like that. But I do believe your overall health is depicted in the foot for sure. So I understand your perspective in Chinese medicine, but I also think that there's most of us walk around with these sluggish, stagnant livers and we don't even know they are. We see our cholesterol go up and we just think we got to take a pill or we got to change our diet, but that stems in the liver. That's a liver issue. So, that's kind of where I mostly go with it.
Yeah, absolutely. This person here said liver would be affected by the adductor. Absolutely. In Chinese medicine, we call it the inner yin. And that's part of where the liver meridian comes up into the pelvis. So yeah, absolutely. I can see that connection for sure. And the liver and the spleen in Chinese medicine have a lot to do with each other. They can really create stagnation or deficiencies. And you see this a lot as an imbalance.
Yeah.
Interesting. Okay, so we did have someone from IG send a question about toe fungus. And, again, not that it's like the funnest thing to talk about, but is there a component with this whole viral load or this chronic inflammation that has to do with a chronic fungal issue?
Well, what's interesting is, I've been treating fungus in my practice forever, right? And whether it's in the skin or it's in the toenails, and it's very, very difficult to get it out of the nails once it's in the nails. So, so what I've really come to understand is that it still tracks back to the liver. It comes back to an overburdened, toxic liver that is not able to convert vitamins and minerals into more usable nutrients for the body, leading to a zinc deficiency. So when you get, like, a lot of these nail things are zinc and silica, you know, there's a lot of missing, a lot of us are mineral deficient, hands down. You know, the soil is depleted, our diet is not correct. So you're going to get that plus a lowered immune system that sets you up for this whole thing. So you have to address the pathogens in the body, which actually can get stuck in the liver. But if you address the root cause of it as a liver issue, you can really move somebody along, as well as giving them topical essential oils and different, you know, supplements to be able to support their liver, some anti-inflammatories, some, like, a lot of C. I use a lot of C, ester C with
Ester C.
With a nail, and then using the topical stuff.
Is there something that you recommend topically? Is there something that people can get?
I use a bunch of different things, but really when I tell people, like, if I'm telling them through a Zoom session, I'm like, because I have stuff in my practice, but I'll say, go get some tea tree oil, some oregano oil, get a carrier oil, put a little bit of lemon oil in there and mix it up. And by the way, toe splitting is a zinc deficiency. That's pure zinc deficiency. If you make a blend and then just put a drop or two on your nail, twice a day, rub it in, but do the internal work. Mm-hmm. Work on your liver, lower your fats, put in, you could use oregano oil internally. Yeah. You could use golden seal and cat's claw. Like, there's so many great remedies to, like, get somebody to help them heal a fungus toenail, but it's not a quick fix. You have to remember, it takes 6 to 9 months for a new nail to grow out. And also, fungus will tend to be in an environment of dark, moist environments. So you got to, like, make sure your shoes are okay. And, there's something on the market called Sherri shoe, where you just stick a UV light into your shoe just to disinfect your shoe. That's so interesting. That's helpful.
So then, this would take me to that next question that I had talked to you about. We're in a culture where people love getting their nails done. Yeah. And, for someone who tries to be as organic and healthy, and, I do like a good pedicure in the summer. Same here. Is there, for you as a holistic podiatrist, like, what do you think of getting your nails done? What do you think about what happens in a salon? That's, what is all that like in terms of, is it safe? What are we putting on our nails? How porous are our nails to take in some of these toxins? What do you find?
Yeah, very, very. It's really important because your nails breathe. And the nails actually show your state of health as well. And so if you're putting toxic chemical-filled nail polish onto your nails, that can get into your body. Absolutely. And so you really need to, in general, one of the things that's important to do is there are companies that have non-toxic nail polish. If you really want to get your nails done, and, women do, and I completely understand that, there are a lot online. You can just look it up. We carry in our office like a cleaner version of nail polish for patients, but you can find it. So you bring your own nail polish. You can bring your own emery board. You can bring your own nail nipper. There are some salons that are cleaner than others where they really do a nice job sterilizing. I always tell people to get a really good bottle of tea tree oil and put that into the water. Just throw some drops of that into the water basin where they're soaking your feet. And at least you'll disinfect the basin that they're, when you sit for a pedicure. So you just put that in there, and that helps a lot. And, so you can either bring your own instrumentation or make sure that you research where you're going, that they're not going to use other toxic stuff on you.
Mm-hmm. Which is a hard one. it's hard to find a place that's going to be non-toxic.
It is. So that's why, I tell people bring your own little packet of stuff for yourself and just bring it to get it done. Mm-hmm. And you take a risk. Listen, we take a risk. You balance what you're gonna do. But I definitely say get non-toxic nail polish to put on your nails for sure.
So one question that I get a lot from patients of mine that have, I'm just going to jump back over to the Achilles tendonitis and plantar fasciitis issues, is those tendons have very poor blood supply, right? Would you agree?
They do.
Right. So when an area has poor blood supply, healing takes so much longer.
It can.
And one of the little tricks that I used to, especially when I was working with City Ballet, one of the tricks that I have them do is a contrast bath.
Yep.
And I have them take 2 buckets and fill one with hot water and Epsom salt. And the other one is cold water with a few ice cubes. And I have them do like 1 minute in the hot heat, 30 seconds in the cold to create a vasoconstriction and a vasodilation. Yep. So it acts like a pumping mechanism to help, bring any of the swelling out of the tissue. And it also just really helps with the blood supply to the tissue that's not getting very good blood supply.
True. That is a component. And then, remember some of those chronic cases also have that viral piece in it.
Right. Well, there's somebody just said EBV on the nerves. That's right.
Yeah, Julie, absolutely. It's EBV on the nerves. So it really is Epstein-Barr that can get into these lower extremity places in the foot. And it's pretty amazing. So what I have people do is I usually do warmth in the morning to retrain the nerves, and then ice at the second half of the day. So contrast is great. I love contrast. But a lot of people, if it's a little time consuming for them, I'll do warm in the morning and ice it down in the evening. And that can help to retrain the nerve.
It's awesome. Such good stuff. And I think somebody else had a last... the Helix Rigidus.
Yes.
This actually was a question that came in after I sent out my newsletter yesterday, because I always ask if anybody wants to be on my newsletter or Sherri's newsletter, you can go to our websites. Do you send out newsletters?
I do.
You do. So you'll get info from Sherri, Dr. Greene, from me, lots of good stuff. But he sent me back an email saying, could you ask her about Helix Rigidus? So can you tell everyone what Helix Rigidus is?
Sure. So Helix Rigidus is it's different than a bunion. What happens is where the great toe joint gets blocked. It's like a bony block, and you can't bring the toe up, which is called dorsiflexion. And sometimes plantar flexion is interfered with as well. But usually there's more of like a bone spurring, like on the top of the joint, which restricts the range of motion. Sometimes it changes the shape of the head of the metatarsal, where there's like spurring on either side of the met head. So it becomes a very rigid first ray. Okay. And it's very difficult for people because that part of your foot is the most important for the gait cycle. Right. And to be able to propulse off of that first ray is everything. Yeah. Because when you can't, you shift your whole gait cycle and you have to walk around your big toe. And not just the whole chain upwards will be affected, right? Yeah. So that's basically what it is. It's just a rigid, first ray, first toe. And I will tell you, I've had really good success with homeopathic injections with that.
I'm sending him your way this week.
I really, really had some good success. It doesn't make the bony spurs go away, none of that. But it really it's when somebody's in a lot of pain. Yeah. So when somebody has a rigid, a Helix limitus or rigidus, you need to usually work with an orthotic with that person, because to break that up there's no breaking that up. That's one of those bony abnormalities. But there are things you can work with nutritionally with pain and inflammation around that joint. But the homeopathic injections can be really so helpful for that person.
And now, would you say the same for someone that has just arthritic joints in their foot, or they're getting older and they've got just degenerative joint issues? Same thing? I mean, do you suggest anything for osteoarthritic changes?
Well, to me, I used to say I hate the word arthritis because I think it's a garbage term that we all use and we throw everybody into that category of like arthritis. And I feel like a lot of that is toxicity in the body.
Yeah.
Like when you really start to flush the body and you flush the liver and you flush things out, you'd be surprised how much that inflammatory piece can get knocked down. Yeah. And then addressing the chronic stuff that ends up in the liver. And then when a joint gets inflamed, like I'll go back to that viral component, there's a piece of that is in there, and there's other toxins that get in there. So when you clean up somebody, I mean, you can really improve rheumatoid arthritis. You can, improve psoriatic arthritis. Like all of these have a viral component long term. So when you cleanse the body, you can actually make a huge amount of change with that.
Absolutely. So this person here is asking about, what about cold feet all year long?
Cold feet all year long. That's usually, that's either liver or viral. Those are one of the two things. And I feel like, we can throw everything. It goes back to the liver. I had, my feet and my hands used to be cold all the time. And I had something called Raynaud's.
Yeah.
Right. It's gone. I don't have it anymore. But that was dealing with the underlying root cause of it, which was cleaning up the liver and a viral component. And you'd be surprised that a lot of the stuff starts to go away. So if somebody's feet is cold all the time, yes, it's a circulation issue, but what's causing the circulation issue? And especially when you're not somebody that, you can't say it's a circulation issue when you're in your 30s or your 40s or your 50s. Like, it's just not. Or even 60s. You got to get to the root of it.
Yeah, interesting. And this person here said turmeric. Turmeric is awesome. It's awesome.
Turmeric, curcumin, it's all so important. It crosses the blood-brain barrier. It's such a rock star of a supplement. And there's so much research that's been done on it. So it's fantastic.
Right.
Yeah, she's doing detox now.
Now we have a bunch of people.
On the liver detox. Be careful on what liver detox, because
you
do not want to push your liver very hard. You have to be really careful about detoxing liver. There's no olive oil cleanses, none of that. So you just need to be careful. And I would really refer people to getting, Anthony Williams' book on liver cleanse called Liver Rescue. It's a phenomenal book. There's so much science in that. Yeah. And really understand how to clean the liver safely and appropriately.
Yeah. I had done a liver detox by a naturopath when I was in acupuncture school. She was an ND. She was in my program, and she put me through a liver detox. And back then, do you remember like the master cleanse?
I did it. Yeah.
I did the master cleanse. I drank water with lemon and honey for 20 days.
Oh my God, you did that for
20 days I did it. Sherri, I was like this.
Oh my God.
It was awful.
That was horrible.
It was awful. So I had the worst reaction. I wound up having, eczematous outbreaks on my hands. My feet were burning. It was bad. It was bad. And so I always say to patients when they come in and tell me they're on a detox or they're on a cleanse, just please be gentle about it.
Yep.
You can just start to change your diet, and that could actually help change things for you, right?
Absolutely.
You don't have to go out and buy $500 worth of products to take. No.
Food. You use food. And you know what?
Food.
It's such an easy way to really take a stepwise approach to do it, and to do it smart.
Yeah.
And with, mindfulness to it, and not throw yourself into some crazy juice fast. You just have to take it. It's so easy the minute you change your diet, the minute you start to lower your fats, you're going to start to cleanse. It can be really simple.
Yeah. All right. Well, it's 9:00. We've been chatting for an hour, and I could chat with you for like 20 hours. I love it so much. I love you so much. I'm so grateful for you to be here with me tonight. You gave everyone such awesome information. I adore you. I love you. Can you tell everyone where to find you, how to find you? I know you're doing telehealth calls. If you need people, you are in New York. Are you back in your practice in New York City?
I'm back in my practice, but we're only there 1 day a week right now. The rest of my practice is actually telemedicine. We're all online, but we are in the office 1 day a week. That may change. It may increase, but for now, just 1 day. But you can email my office at drsherrigreene@gmail.com, and you can ask about it. But we are seeing, in person once a week, but a lot of telemedicine, and it works, and it's fantastic to give people the information that they need and to help move them on their path.
Okay, wonderful. So Dr. Sherri Greene and everyone, thank you so much. This is my 4th week of my Integrative Wellness Collective. Yes. I actually have calendars booked out until June. Every week of amazing practitioners. I'm like beside myself with the amount of knowledge and just women that come on and share their gifts with me. I am beside myself. So I just want to let everyone know, next week I have on my sister-in-law, actually, Michelle Colt. She is an empowering coach or empowerment coach. She works with allowing you to shine your light, and we're going to talk all about generational trauma and ways to allow you to shine your light in this crazy world we're living in right now. Thank you guys so much for coming. So my little tagline is integrate your healing, embrace wellness, and join the collective. So I'm here every week, and you can find me on Instagram. And if you look up on my profile, you can see a little link. You can join and get my newsletters. And please, everyone, if you want great information from Dr. Greene, go to her site and get her newsletters. And she's just such a wealth of information. So Sherri, I love you to the moon and back, and thank you for being in my tribe.
I'll be here next week to hear your sister-in-law. She's great. I'll be here.
Love you. Bye, everyone. Have a great night.